Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: what is pink cocaine? Discover the truth about pink cocaine, the synthetic phenylethylamine 2C-B that has taken the club and party scenes by storm. Despite its nickname, pink cocaine, this popular designer drug has no chemical relation to cocaine. However, its potent combination of stimulant and psychoactive effects has made it a sensation among thrill seekers. Coke, or 2C-B, a mix of ketamine, MDMA, strawberry flavoring, and pink food coloring, is wreaking havoc among drug users and law enforcement officials. Despite its name, pink cocaine, it contains no cocaine but acts like a stimulant. Yet, 2C-B is a dangerous cocktail of drugs that can be even more deadly. Pink cocaine is an artificial man-made illegal drug known as methadone or 4-MMC, or 2C-B. It is typically snorted or swallowed in powder and pill form. It can be dangerous if abused, and its use should be avoided. What is pink coke made from? The pink drug is a novel synthetic drug popularly known and used in rave scenes. Pink coke has raised public health concerns recently and developed a reputation as a high-risk substance that frequently severely influences the user's health. What is pink coke's 2C-B origins? Pink coke has gained its nickname from its trademark pink hue, achieved by adding a significant amount of food coloring to the mix. It is often sold under the street name 2C, pronounced 2C, and has become synonymous with the late-night club scene of young partygoers, especially in Europe. The drug is spreading like wildfire, with increasing seizures made by authorities in Spain and other parts of Europe. Pink cocaine versus cocaine differences. Although both carry addiction and chemical dependence risks, regular cocaine originates from the coca plant's refined cocaine hydrochloride. In contrast, pink cocaine is a synthetic drug that affects the serotonin system. Cocaine's dual effects as a stimulant and anesthetic explain why it is used medically and why it is considered a Schedule II substance in the U.S. What is 2C-B? 2C-B, 2,5-dimethoxy-4-bromophenethylamine, is a synthetic psychedelic drug chemically similar to mescaline and other phenethylamine-based hallucinogens. It can be ingested orally or snorted, and the effects vary depending on the form and method of ingestion. 2C-B is sold under the following brand names: Nexus, Performa, Erox. In the early 1990s, 2C-B appeared in the black markets, first in Europe and later in the USA. 2C-B drugs' popularity grew in the United States, and by the late 1990s, it reached its peak of use among clubgoers and electronic music raves. The use and distribution of 2C-B became associated with fatal overdoses. Consequently, since 1995, 2C-B has been a Schedule I controlled substance in the United States. This means it has no accepted medical use and a high potential for abuse. Since then, the use and distribution of the drug have declined. 2C-B remains a controlled substance prohibited under federal regulations. 2C-B continues to interest researchers due to its unique chemical composition and potential therapeutic applications. Still, its use should only be undertaken with professional medical supervision due to its unpredictable pharmacology and side effects. What are 2C-B symptoms? The symptoms of 2C-B use can vary greatly from person to person depending on factors such as dose, route of administration, and individual tolerance. Commonly reported symptoms of 2C-B use include: changes in perception. 2C-B can cause altered sensory experiences, such as vivid colors or changes in the perception of sound and touch. Euphoria. Some users report feeling a sense of joy or extreme happiness when taking 2C-B. Increased sociability. 2C-B can produce feelings of empathy and social openness. Cognitive effects. 2C-B can affect thought processes and cause mood, attention, and concentration changes. Physical effects. Some physical effects of 2C-B use may include dilated pupils, rapid heartbeat, sweating, and tremors. Nausea. Nausea and vomiting are common side effects of 2C-B use, particularly when taken on an empty stomach. Anxiety and paranoia. Higher doses of 2C-B can cause anxiety, paranoia, or panic attacks in some users. It's essential to remember that 2C-B use comes with serious risks and possible adverse reactions, and little is known about the drug's long-term health effects. Furthermore, 2C-B is illegal in many parts of the world, and its use should not be undertaken without medical supervision or under the advice of a licensed medical professional. Individuals considering 2C-B should educate themselves on the potential risks and make informed decisions. Is 2C-B addictive? Little is known about the effects of pink coke, but one recent experiment on mice found that 2C-B was addictive. This experiment found the changes in the brain and addictive properties of 2C-B were comparable to methamphetamine. Despite the limited research, there is a high potential for abuse and risk of adverse effects. After repeated use, your body may develop a tolerance, meaning you need increasingly higher amounts to achieve the same impact. High doses of pink coke can lead to severe and life-threatening complications. Pink coke's 2C-B overdose risks. Although research is limited to the full extent of the effects of pink coke, high doses of its 2C-B drug can cause excited delirium. Excited delirium can cause severe adverse effects and increases the risk of a life-threatening reaction. The risk of overdose with 2C-B can depend on various factors, including the dose ingested, the purity of the drug, and the individual's sensitivity or tolerance to the drug. Although there is limited information on the effects of 2C-B overdose, some of the possible risks include the following. Life-threatening medical emergencies. Overdosing on 2C-B can lead to medical emergencies such as seizures, respiratory distress, heart failure, or coma. Psychotic episodes. Overconsumption or chronic abuse of 2C-B has been linked to psychotic episodes, including symptoms such as delusions and hallucinations. Mental health issues. Chronic use and overconsumption of 2C-B over time can lead to various mental health problems, including depression, anxiety, and cognitive impairment. Addiction. 2C-B is a potent drug with a high risk of dependence, and individuals can quickly become addicted. It's essential to seek medical attention immediately if you suspect someone has overdosed on 2C-B. It's always recommended to avoid the use of any illicit drugs or other substances of abuse, as excessive use can lead to serious negative health outcomes, including death. Please call We Level Up immediately to learn how our detox and addiction treatment program will help you overcome your pink cocaine addiction. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.